But the interesting thing about the roads at that time was that the edges of the roads were not true. And in one place it was wider than another, so it was very difficult to determine what was the middle of the road. And my dad, when he got out on the highway to paint these lines down the middle of the road, it was difficult to find the middle because they had to lay a chalk line, which was labor intensive.
Oh, yeah.
And so he designed this system of mirrors, which was like a rangefinder. And as the truck went down the road pulling the painting equipment, he was going fast enough so that the edge of the road, instead of zigzagging, it almost was a straight line. And he could stay in the middle of the road, and as a result, paint maybe instead of 5 miles a day, he could paint 50 miles a day. And so he did a lot of things like that. And
that's incredible. So before his time, there were no lines down the middle of the roads?
That's right. And can you imagine today getting on a road or any highway or driving into any city and not seeing those lines?
I can't.
It'd
I can't.
It'd be frightening,
I can't
wouldn't
fathom that. Absolutely. I guess you can't either. Yeah.
But he did a lot of things. He also had a company of school bus stops, and out in the country where kids had having to stand out in the rain sometimes in the weather, and he got companies to pay for the advertising on these little school bus stops, and it's wherever the bus was going to stop, and there was a little house, and the kids were in it, and they were off of the road, and they were out of trouble, and people, just said stay in the house, and they did. And he sold a bunch of those here in North Carolina, South Carolina, Virginia, and Georgia.
That is incredible. With advertising sponsors.
With the advertising sponsored by, I remember one of the big companies that advertised was Carolina Power and Light Company.
Is that right?
In Raleigh, yeah.
That is fascinating, Dr. Sapp. For you think about that. Was it his father or your mother's father that had been a dentist?
It was my father.
Yeah. I mean, there was an inventor, yes, but who had been the dentist? Was that your father's father or your mother's father?
It was my
father's father. Okay,
right.
Sure. And in that, was there anything about the practice that, for him growing up, he must have determined that, I don't want to be a dentist, I want to do something. I mean, did he make a conscious decision to become an inventor?
Well, I don't think so. He really didn't. His brother attended the Baltimore School of Dental Surgery, and but his junior year, he got married and dropped out. And so this was, I guess, maybe one of the things that my parents were concerned about is I was going through school. They wanted me to stay there.
Now, did you ever talk to Baxter III, your firstborn son, or Macon, or even Miranda about getting into, what was it about the practice there? Did they come around the office a lot while they were growing up to see you there?
Well, Macon would work in the practice. He was interested in dentistry. And Macon has a great pair of hands. And he always has. He could fix anything. He could build anything. He almost reminded me of my father in many respects, and he was very efficient at things like this. What was so interesting is I got him a job in a filling station when he was 14 years old, and the guy taught him to be a good mechanic.
Really?
And he got interested in automobiles, and when he was about 14 years old, he wanted an automobile. I said, you can't have it. He said, well, I want to take it apart and put it back together, and he did.
Oh, come on.
Yeah, and today, that's the way he is. He loves automobiles.
Oh, yeah.
But he also loves his profession, and he gives it, the majority of his time nowadays.
Absolutely. If he's not with his two girls,
that's
obviously
right.
He's there
Absolutely.
in the office with a lot of other women, and you've got a tremendous practice up there, and to think about. So it's Sapp and Sapp.
Sapp and Sapp.
DurhamDentist.com. I saw that the other day. Speaking of .coms, we got a .org here, orallongevity.ada.org. I guess that's the best if a viewer, and I know that's been up here on the screen a little bit, but orallongevity.ada.org. If a viewer wanted to learn more about the project, of course, they can also come back and be with us next Tuesday. I think you said you'll be back in town. and we will actually be filming out here again next Tuesday, which we're excited about. But you'll be
Very
back
good.
in town, and sure hope you can come
I
back.
look forward to it. I'll be here
with us. Absolutely. You know, for you, of course, somebody who's been practicing as long as you have, you've seen the issues there. Have there been anecdotally or direct evidence where you think about some of your patients that you've really seen their health either deteriorate because they haven't taken good care of their teeth, or that their health has really stayed in good shape because they've been very consciously taking care of their teeth?
I've always felt like, and I've seen evidence over 57 years, that people who keep their teeth are healthier. But there is people have to be very determined about their oral health care on a day-to-day basis. Sometimes the most efficient individual will, for some reason, change toothbrushes, and he'll miss a place in his mouth, and I will go in there and touch that area, and it'll bleed.
Oh boy! And
I tell them, I said, listen, you are missing this. You need to give it more attention, and just have a system and going around the mouth to clean your mouth in a most effective way for at least 2 or 3 minutes. And I think you can get rid of that. And next time I see them, that inflammation, that bleeding is gone. Because
they just took it. And you were highlighting somebody who's very efficient and maybe all over their mouth, but leave out one little spot.
Well, you know, some people don't go to the dentist. You know, about maybe 60% of the people go to a dentist, actually, in the United States.
Is that right?
That's right.
Only 60% of the
population
population actually sees a dentist. You mean at all or on a regular basis?
Well, I think the figures there at all.
At all.
But then when you look at it on a regular basis, I haven't got any figures on that.
Right, sure.
But it's awfully good. You know, if you stop and think about this, people go in for a physical examination, which is important.
Right.
Some people don't go into a physical examination, and they wind up having some disastrous, terrible health problem that sometimes takes their life.
That they just didn't know about.
But I'm always so pleased in having my patients come in, you know, on a routine basis, and as a result, they keep their teeth for the rest of their life. And I think all dentists can attest to that those patients who give them an opportunity to look after their mouth on a, you know, monthly, not day to day, but you know, appointment level program, they keep their teeth. And one of the great pleasures that you have whenever you reach senior age, and that you may be 75 or 80 years of age, you have some conditions that slow you down and compromise your life. But one of the great things is to be able to sit down and have a good meal. Yeah. That is one of the great blessings of old age.
To use your teeth, natural or other, just to be able to sit down. And you're highlighting to use your natural teeth there.
Well, it's interesting. I had a patient in recently who shared a story with me. She said, you know, I've got my own teeth, my natural teeth, and I go to the dining room to have my meal, and I have my friends who I know are wearing artificial teeth, and some who maybe don't have their teeth, and I watch them, and they push the food around their plates, and I don't know what to do with it, but they don't eat it. And but I'm so pleased that I can, you know, chew my food, swallow my food, and be very content that it's well digested when I eat it.
Well, that's why it's so important right now, even though our focus is the Oral Longevity Project in this 3-year campaign, and focusing on nursing homes and focusing on retirement communities, folks oftentimes older than 65 and even older than 85 that you were just highlighting there. But really, this starts at an early age. It needs to. For her to have those teeth at 80 or 85, she had to have gotten consciously focused on this at a much earlier age than even you contemplated going into dentistry. I mean, she had to get focused on this when she was a child. So where we're potentially talking to seniors today and next Tuesday, a lot of the focus needs to be on folks at a much earlier age.
Well, you know, the Oral Longevity Program is not focused on the younger people. But what you have to stop and think is that people who are 30, 40, 50, 60, 70 years, they're going to be 85, 90, and maybe 100 years of age. And they're going to be in that age where they are compromised health-wise, because that's what aging is all about. Mm-hmm. And you have to learn to live with that. And if you get there with your teeth, it makes life a lot easier.
Think back to your first couple of years of practice, or maybe even there at Duke, the early stages, some of the biggest differences, some of the biggest advances in dentistry. What's the most prominent that sticks out in your mind, Dr. Sapp?
Well, one of the things that was so dynamic to me was when I went in to join the staff at Duke University. I had the pleasure of working with the original people who started that wonderful institution at Duke University Medical Center.
Right.
And I had lunch with them every day, and we talked. And it was interesting to see what was happening in the medical profession as it was developing and growing. And as you well know, I mean, that medical center has exploded and is becoming a world-class medical center.
World-renowned.
World-renowned. And it's huge now compared to what it was.
Oh, yeah.
I remember years ago we had a little small parking lot in front of the hospital that everybody parked in, and now we have trouble finding a place to park in.
And even their very large parking
right.
lots.
Yeah.
Yeah. Yeah. Duke Health.
And Duke Health is reaching out to other areas, and they are, they're all over North Carolina now, and I imagine they're in some hospitals in Florida, and I'm sure other states also. Mm-hmm. It's expanded, but all of this is part of their oral longevity program.
Absolutely.
Because we are looking now at the fact that it's not dentistry and medicine, but they have come together much closer, because they are very much related.
Speaking of come together, we're going to have to come together again next Tuesday. If you're willing to be with us, we've run out of time today, I'm sorry to say, but would you be willing to come back and be with us next Tuesday here if Coastal Carolina University would be nice enough to let us back in this great conference room?
I'm complimented by your invitation, and I promise you I'll be there.
Fantastic.
Okay.
Thank you, Dr. Sapp. Stay tuned to a little more of Dr. Baxter Sapp, Jr. coming up next. One of the shared goals of all humanity is to grow old with dignity. Think about that, to grow old with dignity. If you've been sitting here the last 30 minutes, we're not thinking about growing old. We're thinking about how can we make a difference to the community, and it's personified in Dr. Baxter Sapp. Recognize it. Go online to orallongevity.ada.org or call your dentist and ask about this caring collaboration, the Oral Longevity Project, sponsored by the American Dental Association, the American Dental Association's Foundation, and GlaxoSmithKline. Folks like Dr. Sapp making a difference every day. Stay tuned. A little more of you next Tuesday. Absolutely. Thanks so much for being with us.
Thank you.